Today, we're talking about lung cancer and how to better understand your risk, as well as the treatment options that are available.
So joining us this morning from the Sandra and Malcolm Berman Cancer Institute at GBMC is medical oncologist and hematologist, Dr. May Tang. Welcome.
Thank you.
Well, thank you for being here. So how common is lung cancer?
Lung cancer is very common. In the United States, we have more than 50,000 new cases every year. And then we also have patients who will die from the lung cancer. So, it's a leading cause of death in the world in both men and women.
Wow. So being so prevalent and such a risk to have lung cancer, who should get screened?
Screening wasn't available not too long ago. And then thanks to this national clinical trial that showed the low-dose CT scan can save life.
Wow.
So currently, Medicare actually pay for the screening for patients in high risk. So not everyone needs a screening, but certain patients who.
This is the Maryland Emergency Management Agency with the coordinated test of the emergency alert system. Broadcasters are testing equipment used to warn you during an emergency. This concludes the test of the emergency alert system.
If someone smokes 1 pack a day for 30 years, or someone smokes 3 packs a day for 10 years.
Right, okay.
That would be the 30-pack year. But also if someone quit, but quit within last 15 years and hit that 30-pack year smoking history, that should be one of the risk factor too.
Okay, so if you've quit within the last 15 years, you're still at risk. You should probably get screened. What are some of the treatments available at GBMC for someone who does have lung cancer?
That's a very exciting topic because in the last 10 years, especially last 5 years, lung cancer treatment changed dramatically. Today we have immunotherapy, we have targeted therapy, in addition to chemotherapy. So patients live longer, patient has better quality of life.
Okay, so talk to us about clinical trials and why they're so important.
Yes. The current treatments, the therapies we have today, was in clinical trials not too long ago. One particular trial we participated is the Pacific trial, which used immunotherapy in stage 3 lung cancer patients. After they finished the standard treatment, adding the immunotherapy to their treatment actually improved the survival from 30 to 50%.
Okay, so we have the information on our screen. How do we know that, what do we do if we decide that we want to be part of one of these clinical trials?
Yes, so clinical trials are the concept that is in the testing. So it's not a proven treatment or standard treatment. So each patient will be screened based on the trial requirement. So if patient is interested in specific trial, they will come in, talk to our physicians and also the research nurses, coordinators, and we will start active screening. If the patient fits the clinical trial requirement, then trial is an option. I always tell my patients it's not obligation, but it's an option.
So talk to us about the team of doctors that you guys have there at GBMC.
Yes, so in Cancer Center in GBMC, we are 6 medical oncologists together. Each of us has specific interests. That's my group. And each of us has specific research interests. My specific interest is in the head and neck cancer and the lung cancer.
Okay, so where can people go to find out more information about cancer treatment at GBMC?
So GBMC has a very comprehensive website, which you can see on the screen. Under the website, there is information about clinical trial, how to access the trial, how to access the treatment team, especially for lung cancer, we have a multidisciplinary team that including the surgeon, medical oncologist, radiation oncologist, and the pulmonologist on the team.
All right, I love it.
Yeah.
So all the information there available on the screen. You can get all the information that you talked about with the clinical trials, and then they can look you up and certainly pay you a visit.
Of course.
All right, well, Dr. Tang,
Love
thank
to
you
see
so
that.
much for being here with us today.
You're welcome.